The alert screamed through Unity Station Medical Hub like a blade across nerves. Director Torek's primary sensory frill flared, his four-fingered hand gripping the edge of the command console as the casualty list scrolled. 57. 57 sentients inbound from the shuttle Prosperity's Edge, which had suffered a catastrophic reactor breach during docking. Burn trauma, crush injuries, explosive decompression, internal hemorrhaging. The triage tags auto-populated in shades of deepest urgency. "All personnel to Bay 9, Torek shouted, his translator clipping the edges of his native Valan harmonics. "We have mass casualties. Prep trauma rooms 1 through 8, commandeer the recovery suites. I want field kits in the corridor." He was already moving, 6 limbs propelling him down the sterile corridor with the staccato click of chitinless feet. Behind him, the hub's medical staff scrambled. A Kethri resident shed their thermal cowl in haste. A pair of Jorani technicians began recalibrating the atmospheric isolators to accommodate incoming species variants. But when Torek burst through the pressure doors of docking Bay 9, he stopped. His frill flattened. The cargo sleds were already there. The victims lay in neat rows on the deck plating, organized by severity. Tourniquets, actual physical tourniquets, not smart gel packs, had been cranked down on severed limbs. Emergency airways had been inserted, some still bearing the smeared print of fingers. Blood-soaked fabric strips packed deep wounds. Fluid bags, clearly scavenged from a field kit, hung from improvised hooks on bulkhead struts, dripping life back into failing bodies. And every single patient had a hand-scribbled triage tag tied to an appendage, written in universal medical code, with vital signs and interventions noted in crisp, angular script. A junior medtech, one of the Jorani, was staring at the tags with all 4 eyes dilated. Torek seized them by the shoulder. "Who did this?" The Jorani's throat sac quivered. "Director, we found them like this when we arrived, but there was someone here, a figure. They ran when they heard us coming." "Who?" I caught a glimpse before they vanished into the access shaft. The tech's voice dropped to a frightened whisper. It was the suspended one, the human. Torek's frill went rigid. "Nurse Kai, that's impossible. They've been confined to quarters for the last 2 cycles under Level 3 behavioral lockdown. Their access codes are revoked. Their biometrics are flagged. How could a single suspended nurse possibly?" He looked again at the 57 victims, at the precision of the field surgery, at the sheer, staggering scope of the work. The numbers didn't add up. No single being, not even a Valan surge team, could have triaged 57 multi-species trauma patients in the time between the explosion alert and the sled's arrival. And yet, the evidence lay before him, breathing and alive. Torek felt something he hadn't experienced in decades of medical administration, the cold prickle of awe bordering on fear. He turned and strode toward the restricted quarters wing, his mind racing through protocols and punishments, but behind those thoughts, a single question burned. What manner of creature ignores suspension to walk into a charnel house alone? 1 standard cycle earlier, the tribunal had pronounced its judgment. "Nurse Kai of Terra, you are hereby suspended from all medical duties for a period of 6 standard months, pending permanent revocation review." Chief Medical Arbiter Varnok's voice was a dry rattle, his insectoid mandibles clicking with judicial finality. "You administered a Class 7 metabolic stimulant, banned under the Sentient Pharmacology Accord of the Third Galactic Compact, to a Kethri diplomat without consent, without species clearance, and against the direct order of your supervising physician." Kai stood at attention, wearing the plain gray uniform of a Unity Station nurse, their hands still bearing faint chemical stains from that night. The Kethri diplomat had been in cardiac cascade, minutes from organ dissolution, and the only drug that could restart his dual ventricle heart was a human-formulated epinephrine analog that had never been tested on his species. Kai had calculated the risk in 3 seconds, administered the dose, and stabilized the diplomat. The diplomat had survived, and Kai had been charged. "Do you understand the severity of this ruling?" Varnock asked. Kai's voice was even, unmodulated by fear. "I understand that the patient is alive. I understand that if I had followed protocol, he would be dead. I understand that every day, beings die in this station because the rulebook is 3 centuries behind the medicine." The arbiter's thorax heaved. "Arrogance. This is precisely the human contamination we feared. You are confined to your quarters. If you attempt to access any medical bay, any patient, any treatment matrix, you will be deported." Kai was led away by security personnel. They didn't struggle. They simply walked, eyes forward, and the last thing they heard was Varnock muttering to a colleague, "These humans. They think compassion justifies anarchy." In their quarters, a narrow cell with a sleep platform and a comm terminal set to receive only, Kai sat in the dimness and waited. The terminal droned with station announcements, docking schedules, weather in the Agri Ring, a cultural festival in the Tari Enclave. Then at 3:47 station time, the alert came. "Explosion, docking bay 9. Multiple casualties, all medical staff respond." Kai straightened. The terminal showed live data, estimated 50 to 60 victims, mixed species, trauma spectrum, and the staff roster. Kai's eyes scanned rapidly. The night shift was skeletal. The surge team was on a drill at the outer ring. Torek wouldn't have enough hands for 20 minutes, and 20 minutes was the difference between brain death and survival for a hemorrhaging patient. Kai's fists clenched. They'd spent 4 years as a combat medic in the Proxima Siege, patching Marines under artillery fire, performing field amputations with a headlamp and a bone saw. They knew what mass trauma looked like. They knew the window. The door's electronic lock was a standard Vailland design, resistant to code override but vulnerable to physical bypass if you knew the maintenance conduits. Kai knew them. They'd done rotations in engineering. One sharp yank on the wall panel, 3 crossed wires, and the lock disengaged with a soft hum. Kai slipped into the corridor, grabbed a field kit from an unlocked storage closet, and ran toward Bay 9. The deck vibrated under their feet. They didn't care about the suspension. They didn't care about deportation. 57 lives were screaming into the void, and Kai was the only one who could hear. The cargo bay was a nightmare painted in spilled fuel and torn metal. The Prosperity's Edge had not been a large shuttle, a mixed passenger transport carrying laborers, a few Tari families, some Valdun engineers, but the reactor had cracked open 200 meters from the docking seal. The blast wave had crumpled the hull like foil, and the emergency bulkheads had saved some, but not before explosive decompression had done its work on the forward compartments. Kai didn't pause to catalog the horror. They'd seen worse. Proxima had taught them that hesitation was a luxury paid for in corpses. They moved. First, triage. Kai's eyes swept the sprawl of bodies scattered across the cargo sleds that rescue drones had deposited. The Jorani had already pulled the survivors out, but they'd done no field treatment. Standard protocol said to wait for species-matched medics. Kai ignored protocol. Bleeding, breathing, brain. They knelt by a Kethri woman whose lower arm was a mangled ruin, arterial spray painting the deck. Kai tore a strip from their own uniform, knotted it above the wound, then grabbed a metal strut from a shattered crate and twisted the fabric into a crude, windless tourniquet. The bleeding stopped. A Valdun male next to her had a crushed thorax, his respiratory plates caved inward. No time for a thoracotomy kit. Kai grabbed a sterilized airway tube from the field kit, braced the Valdun's head, and inserted it directly into the tracheal slit, forcing the breathing passage open. The Valdun's body spasmed, then oxygenated. More bodies. A Tari child, no more than 6 cycles, unconscious from smoke inhalation and a fractured skull. Kai cleared the airway with 2 fingers, tilted the small head, and breathed directly into the child's nasal slits. A risky cross-species maneuver, but Kai knew Tari physiology from their Proxima days. The child gasped, coughed, and wailed, a glorious sound. But the worst was a humanoid Jorani whose abdomen had been torn open by shrapnel, the liver analog lacerated beyond clotting capacity. Kai's hands pressed gauze into the wound, but it was a losing battle. The Jorani's blood was a slow amber ooze, and there was no synthetic substitute in the field kit. Kai made a choice. They learned the truth about human blood years ago, a secret buried in Black Ops medical files from the first contact wars. Humans were universal donors for an enormous swath of carbon-based life, a quirk of convergent evolutionary ancestry that the Galactic Compact had suppressed to prevent humanity from becoming a biological resource. Kai grabbed a transfusion line from the kit, jammed one end into their own antecubital vein after a brutal bite to break the skin, and plunged the other needle into the Jorani's major abdominal vessel. Their blood, dark and oxygen-rich, flowed into the dying alien. It wouldn't clot, it was a stopgap, a desperate bridge, but it would buy minutes. Minutes Kai could use to save the next and the next. They worked in a haze of adrenaline and controlled hyperventilation. Tourniquet, airway, pack, transfuse, triage, tag, repeat. At some point, a Jorani medical technician arrived first, dropped their gear, and simply stared. Kai shouted, "Hold this pressure," and the technician obeyed, too stunned to question. When the main medical team finally stormed the bay, Kai was on the 56th patient, hands crimson, uniform soaked, a strip of their sleeve tied around their own bleeding arm where they donated twice. They saw the white of Torek's uniform and knew the moment was over. So they finished the last airway, slapped a tag on the patient, and vanished into a maintenance shaft before anyone could stop them. They'd done what they came to do. Now they had to face the cost. Director Torek stood in front of the wall-sized holographic display in the medical hub's secure observation room, replaying the security footage for the 5th time. The grainy feed showed Bay 9 from multiple angles. The camera that caught Kai was the one mounted above the emergency pressure seal. It captured a human figure, moving with an economy of motion that Torek's own trauma teams could never replicate. Not faster than a Valen, not stronger than a Jorani, but something else, a kind of relentless, pattern-based violence against death itself. Kai never stopped. They knelt, ripped, twisted, inserted, breathed, packed, wrote, and moved to the next body with a mechanical intensity that seemed to ignore pain, fatigue, or the blood that was clearly seeping from their own arm. Torek slowed the feed at the moment Kai inserted the transfusion line into their own vein. His frill pressed flat against his neck in an unconscious display of shock. That act alone violated a dozen biological contamination statutes. And yet the Jorani patient's vitals had stabilized for a full 14 minutes before the synthetic plasma arrived. The director turned away from the screen. He had to find Kai before security did. Kai was in Recovery Suite 3, standing beside the Tari child's bed, adjusting a neural monitor with one hand while the other rested, almost absently, on the child's forehead. The child's mother sat in a corner, watching Kai with an expression Torek couldn't translate. "Nurse Kai," Torek said, his voice carefully level, "you are in violation of a legally binding suspension order. You broke out of confinement. You stole medical supplies. You physically injected yourself into a patient of a different species. Explain." Kai's hands didn't pause. "The child's intracranial pressure is dropping. She'll wake in a few hours with no deficit." "That is not what I asked." Finally, Kai turned. Their face was drawn, smeared with dried amber and crimson, the bite mark on their forearm still oozing, but their eyes were steady. "Director, you received the casualty alert at the same time I did. You know your surge team was 20 minutes out. You know that with 57 crush and bleed patients, triage without immediate intervention would have yielded maybe 12 survivors. I did the math. Then I stopped doing math and started doing medicine. Torek's translator struggled with the inflection. You believe the arithmetic of survival justifies violating law. I believe you don't let people die on a technicality. Kai's voice cracked, just for a syllable before firming. Out there on the Proxima front we had a saying, bureaucracy has no place in a triage tent. I guess it's true out here too. Torek was silent. He stared at the Tari child whose breathing was now deep and regular. He looked at Kai's arm, at the dark stain on the floor where droplets had fallen, at the 56 other patients in the wards beyond, all stable, all alive. When he spoke again, his voice had lost its prosecutorial edge. The board will convene tomorrow. They will want to expel you permanently. Varnock will argue you're a danger to galactic order. Kai nodded. I know. You don't seem concerned. Kai finally pulled their hand away from the child's monitor, flexing stiff fingers. I'm concerned about the patients. The board can do what it wants. Torek hesitated, then did something he'd never done in his career. He reached out and placed his secondary limb on Kai's shoulder. Get that arm treated. I'll speak to the board. The tribunal chamber was a semicircle of white and gray, the walls embedded with the seals of 17 member species of the Unity Station Medical Compact. Torek had always found it imposing. Today, it felt like a gauntlet. Chief Arbiter Varnock presided from a raised dais, his multifaceted eyes reflecting the chamber's light in fractured rainbows. The other board members, a mix of Vailans, Kethri, and 2 hard-shelled Vorn, sat in a crescent below him. Let the record show, Varnock intoned. That nurse Kai of Terra stands accused of violating suspension, theft of medical resources, biological cross-contamination through unsanctioned tissue exchange, and reckless endangerment of 57 sentient lives through unapproved interventions. Torek rose from his seat. And let the record also show that all 57 of those sentient lives are currently stable and recovering. The chamber murmured. Varnock's mandibles ground together. Director Torek, your defense of this human borders on professional insubordination. Maybe, but I've watched the footage, Arbiter. I've seen what Kai did in that bay. It wasn't reckless. It was the most precise field triage I've ever witnessed. They didn't endanger lives. They preserved them against a 90% projected fatality curve. If we're going to punish someone, perhaps we should also ask why our protocols couldn't have done the same. A Vorn board member, Admiral Captain Emrak, leaned forward. The human broke the law. Intentions do not matter. If we allow this, we signal that any species may override the compact whenever they feel morally justified. Chaos follows. And if we don't allow it, Torek shot back, we signal that our laws are more important than the lives they supposedly protect. The argument raged for nearly an hour. Kai stood in the center of the room, hands clasped, saying nothing. The tribunal brought up old human conflicts, the Proxima incident, the so-called Human Recklessness Index. Torek countered with survival statistics, patient testimonials, and the simple, undeniable fact that a suspended nurse had performed what a fully staffed medical hub could not. Then the rear doors opened. A small figure shuffled in, supported by a Jorani orderly. It was the Tari child. Her head was bandaged, her movements uncertain, but she was walking. She was alive. The chamber went still. The child's large, dark eyes found Kai. She pulled free of the orderly and wobbled across the floor. No one stopped her. She reached Kai and wrapped her thin arms around the nurse's leg, pressing her face against the blood-stained uniform. "Warm hands," she said in halting universal. "Warm hands pulled me out of the dark." Varnock's frill fluttered. The Vorn's armored plates clicked, a sign of deep disquiet. The chamber had no protocol for a small child interrupting a prosecution. Torek seized the silence. I move for an immediate recess to reconsider the charges. The motion passed without a single dissenting vote. In the recess, Kai was allowed to sit. The child was gently taken back to recovery. Torek brought water, human-compatible, unflavored, and set it on the bench. "You need to tell them more," Torek said quietly. "The board is wavering, but they need to understand why a human would do this. Not just the biology, the reason." Kai looked down at their hands. The transfusion wound had been closed, but the ache lingered. "I grew up on Proxima," they said, voice low. "The siege wasn't a battle. It was a slow bleed. 6 months of bombardment, supply lines cut, and the Compact's relief fleet waiting at the system edge because of a political dispute over intervention rights." Torek said nothing, letting them speak. "I was 17 standard years old when I enlisted as a medic. I watched friends die from wounds we could have fixed if we'd had a proper surgical bay or just more blood. I watched a child, my neighbor's kid, bleed out from a leg wound because our plasma supplies were exhausted. I held her hand. She asked me if help was coming. I said yes. I lied." Kai's voice cracked open, raw and unpolished. "After Proxima fell, I made a promise. I would never again let a patient die because a rule, a regulation, or a border kept me from acting. That promise is the core of who I am. It's why I injected the Kethri diplomat. It's why I broke into that bay. It's not arrogance. It's penance." When the tribunal reconvened, Kai stood again, but this time they met every eye. "You want to know about the blood," Kai said. "You want to know why my transfusion didn't kill the Jorani. It's because human blood carries a universal antigen cluster that's compatible with the majority of carbon-based life in this galaxy. We were seeded. We're the missing link in a biological chain that connects half the sentient species in this room. The Compact knows this. They classified it 3 centuries ago after the first contact with the Vailans, to prevent humanity from being reduced to a blood farm." The chamber erupted. Varnock slammed a gavel-like appendage. "This is preposterous." "It's true," Kai said louder. "Check the classified archives. Check the genetic data. Every drop of my blood in that Jorani's veins was a bridge, a temporary one, but a bridge. I didn't just guess, I knew." Torek watched the board members' faces shift from outrage to horror to something else entirely. The Compact had lied to them, for centuries. And a human had just torn the secret open to save 57 lives. The tribunal's final session was brief. Chief Arbiter Varnock, visibly shaken by the cascade of revelations and the sheer weight of public sentiment flooding the station's communication nets, delivered the verdict in clipped, reluctant tones. "The board, in consideration of the extraordinary circumstances and the testimony provided, hereby rescinds Nurse Kai's suspension and reinstates all medical privileges. Furthermore, we grant a provisional charter for the development of a cross-species emergency protocol that incorporates human-innovated techniques. This charter will be overseen by Director Torek and Nurse Kai." It wasn't an apology, but it was a beginning. Kai spent the next cycle visiting every one of the 57. The Kethri woman with the tourniquet was already being fitted for a prosthetic. The Valdan engineer, breathing on his own. The Jorani who had received Kai's blood. Their name was Draven, and they wept when Kai entered the room, grasping Kai's hand in their 3-fingered grip. "I should have died," Draven rasped. "My species. We don't accept foreign tissue, but your blood, it didn't fight mine." "It held on, how?" Kai smiled, that tired, honest expression that Torek was beginning to recognize. "Because we're not that different. You and I, deep down, on a level older than our governments, were family." Finally, Kai found the Tari child, whose name was Lyra, sitting up in bed and drawing on a datapad. She looked up and grinned, a gap-toothed expression of pure relief. "You came back." "I never left," Kai said. "I'm just slow." Lyra held up the drawing. It was a crude but vivid image. A figure with red hands standing over many small bodies, and above them a single line of script, "The one who warms the dark." Kai felt something in their chest loosen. They'd carried Proxima's ghosts for years, a weight that never lightened. But standing there, they realized that the child in front of them was the same age as the one they'd lost, and this one was alive. Director Torek joined them at the observation deck later, where Kai was staring out at the docking bay, now fully repaired, ships cycling in and out. The first training cohort arrives next week, Torek said. 12 species all wanting to learn human triage. You've started something. Kai didn't reply immediately. They were looking at the stars beyond the station's translucent hull, not with longing but with readiness. Somewhere out there, another disaster was building. Another crisis would come, and they would be there. It's not just triage, Kai said at last. It's a mindset. Don't wait for permission. Don't let a rule steal a life. That's what I'll teach them. Torek nodded slowly. You know, we were afraid of humans for so long. Your physicality, your aggression, your refusal to follow herd logic. But I think we were afraid of the wrong thing. Kai turned, eyebrow raised. It's not your strength that changes everything, Torek said. It's your stubborn, unkillable belief that every single life matters enough to break the world for. Kai looked back out at the stars, a ghost of a smile on their lips. That's not a human trait, that's just a nurse trait. We're just the ones who took it too far. Torek's frill rippled with what might have been a Valen laugh. I'll note that in the charter. Caution, nurses may break reality to save patients. Will that suffice? Perfect, Kai said. And somewhere on the station, 57 hearts beat steady proof that some rules were meant to be shattered.